The question of anal sex after surgery is a complicated one. There are many situations where it may be perfectly fine to have anal sex. However, there are others when it can pose serious health risks. If your surgery was abdominal, such as a hysterectomy, you will likely be advised to avoid vaginal and anal sex for 6 weeks. This is because there is only a thin membrane separating the rectum from the abdominal and pelvic organs. Anal sex can press on this membrane and cause damage to internal incisions. It can place undue stress on external incisions. As a general rule, it is never a good idea to have sex immediately after surgery on any abdominal organs such as the liver, kidneys, or stomach. Even surgeries involving the thorax, chest cavity, may require the temporary avoidance of sex. Your surgeon will also advise against having anal sex following rectal, colon, or anal surgery. This includes hemorrhoid surgery and prostate surgery. Depending on the type and extent of the surgery, you may need to avoid sex for 6 weeks or more. If your surgery had nothing to do with your genital or abdominal areas, your surgeon may advise you to take a short break from sex. For example, if you had rotator cuff surgery on your shoulder, your surgeon may advise you to refrain from sex for a week just to be safe. As a summary, anal sex may need to be avoided after surgery as it can disrupt incisions and place excessive pressure on the surgical site. Sex should be avoided for 6 weeks following surgery on the abdomen or pelvis. Anal sex may need to be avoided for at least 6 weeks following anal, rectal, or colon surgery. Even when it is okay to have sex following anal or rectal surgery, use plenty of lubrication to avoid damaging vulnerable tissues. Condoms should also be used to avoid infection. Injuries can sometimes occur as the result of anal sex. Surgery may be needed if a foreign object is accidentally lodged in the rectum. Surgery may also be needed to repair the perforation of the rectum or colon during vigorous anal sex.